Chronic cough or throat clearing can be bothersome, embarrassing, and often irritating to your throat or voice. The following exercises, often in combination with medical management with your doctors, can help provide relief and help break the vicious cycle of irritation. Let me explain. I like to compare chronic throat clearing to scratching a mosquito bite. Most of us are familiar with the notion that if we scratch the bite, it swells up, it gets more red and itchy and irritated, causing us to want to scratch it even more. Think of the cough and clear in a similar light. Every time you clear or have a prolonged cough, your vocal cords slam together. You are essentially scratching the itch, making the vocal cord tissues more red and inflamed, causing us to often feel chronic irritation in the form of a tickle or thickness in the throat. The first alternative strategy is increasing your awareness. So thinking about why are we needing to clear our throat? What is triggering us? Oftentimes it's a habit and we don't even notice that we're doing it. So we must be aware of this behavior in order to start reducing it. So sometimes we're clearing because we have a tickle in the throat or we feel mucus. Sometimes we're clearing because we're talking a lot. Maybe we're feeling dry or tight in the throat, and it might be due to muscle tension. The first thing that we can do is to actually sip some water. This might be something that you've already tried, pretty automatic or sort of logical to try. So sipping water can be great to help swallow mucus or pass the sensation. It also helps to hydrate us, which can be why we might be having some of these issues in the first place. The second thing that we can try is to dry swallow with just our saliva. One type of swallow we can do is called an effortful swallow, where we're just squeezing a little bit harder in the throat to swallow mucus or pass the sensation. The second kind of dry swallow that can be very successful, and a lot of people really like this because it's something you can do very simply to yourself, is to chin tuck swallow. Tucking the chin to the chest and giving a hard swallow changes the pressure in our throat that helps pull down thicker mucus or pass the sensation. Just like that. You can do it more than once as needed. Another exercise that can be really helpful to avoid clearing, if you're in a place to do so, is humming. Humming can help vibrate the vocal cords so that we break up the mucus that is on the vocal cords so that we can swallow it. Or if we are clearing because of our voice, feeling like our voice didn't come out normally or we're having tension, humming actually is a very therapeutic exercise that can open and relax the throat, vibrating the vocal cords and helping us to increase our resonance so that our voice comes out a little clearer. Something really easy like that. We can even hum into what we're going to say. Another exercise is, if you know how to do this and you're being taught how to do this, you can use laryngeal massages and stretches to actually help pass the muscle tension that might be causing some of your clearing. Now let's talk about the last resorts. I call them last resorts because they still use your vocal cords in some way, or they're a little bit more of a harsh behavior. However, they're not necessarily as impactful as slamming the vocal cords together. The first one is called a gentle throat clear. And what that is we are going to puff air from the vocal cords to kind of clear the vocal cords of any mucus or maybe pass the sensation of a tickle. It sounds like this. Pretty simple. The second one is a huff cough. This one can be a little tricky, and if you have asthma or think that this won't feel good to you, don't have to do it. It can be really great, especially if you have chest congestion, to help clear the bronchioles. But also, it can be really helpful to blast air through the vocal cords to clear any mucus in that region as well. So what we're gonna do is we're gonna kick our belly, we're gonna kick from the diaphragm, a big blast of air on an H-like sound, almost as if we're wheezing. It's going to sound like if you have trouble feeling it in the belly, try a loud S to engage these stomach muscles, and then replace the S with an H. So that is another alternative strategy to avoid clearing, and that does not involve our vocal cords coming together.